Hello, this is my presentation on utilization of diagnostic ultrasound in athletic training. To start, diagnostic ultrasound usage in physical medicine or in medicine period is an up-and-coming topic. It's relatively inexpensive compared to its alternatives. There is absolutely no radiation exposure with the use of diagnostic ultrasound. And there are a myriad of different types of machines, many of which are portable, which make it ideal for the athletic training setting for sideline usage and whatnot. But with that being said, very little has actually been done in the realm of athletic training with the usage of diagnostic ultrasound. Um, the first thing I want to talk about is the cost. Again, it's very inexpensive compared to its alternates such as MRI and CT X-rays. Over the course of one calendar year, there was a study that was performed that looked at patients that could have benefited from an MRI or CT or X-ray versus an ultrasound. And what this particular clinic found, that out of all the patients that they saw in a year that they would have normally referred out to an MRI, CT, X-ray, so on and so forth, that patients would have waited an extra 7,620 days. Would have spent an extra $16,256 out of pocket and exposed to an extra 20 servants of radiation. It's important though to consider different factors though in assessing cost. These numbers in a lot of these studies could be easily changed depending on the brand of the ultrasound unit studied, the model of the unit. You've got anywhere from your basic models all the way up to your Cadillac models, very nice models that can do a lot of different things. Transducer types, there's a wide range of transducers out there that some have more utility than others. Some are very specific for specific body parts. Warranties, upkeep costs, software updates, and of course the option of portability, which would be a very serious consideration in athletic training. So another topic to consider are educational strategies. In the literature, there's many documented advantages to using diagnostic ultrasound to evaluate musculoskeletal injuries. You can visualize many different types of structures, soft tissue, bony, but one of the greatest benefits is that you can visualize structures during dynamic movement, which you can't really do with too many other diagnostic tools. You could potentially do that, I guess, with a fluoroscopy, but I don't think that's really been studied much either. Because there's a wide variety of structures that can be visualized, many different specialties in medicine have adopted the usage of diagnostic ultrasound. And with that being said, there's been many different types of styles of teaching how to use and understand what the results mean from diagnostic ultrasound usage. If we look at rheumatology, oftentimes they're going to be examining joints in their systemic diseases such as lupus. There was one study that looked at creating an online training module and where they taught 60 rheumatologists how to properly use diagnostic ultrasound. The study was conducted over a 6-month period, or the training sessions, I should say, were conducted over a 6-month period. And it began with a 3-day in-person teaching session, followed by a bunch of web-based models or modules to continue the education. The pass rate was just below a quarter, which isn't probably that great in the grand scheme of things, but it's a start. So maybe that they were onto something, they could have tweaked their educational strategies, didactic strategies to perhaps increase that first-time pass rate. Another study examined a self-teaching approach where a novice diagnostic ultrasound user was taught by an experienced ultrasound user. This novice only had basic anatomy training. I'm not sure what they meant by how they exactly defined basic, but the wording used in the study was basic. And after this novice practiced for 24 non-consecutive hours, the novice was able to capture images on an individual subject or patient that were very comparable to what an experienced sonographer would have been able to capture. There was a study that examined the creation of a curriculum that was specific for sports medicine fellows, so physicians. It consisted of 4 components: a lecture-based, classroom-based learning sessions, as well as classroom-based lab sessions, the didactic practical sessions, mentored clinical experiences in real time, real life with real patients, and then of course supplementary or continuing education type um, programs to help facilitate the learning process. They discuss ultrasound principles, exam techniques for specific body parts, how to do proper documentation, and so on and so forth in this curriculum. I want to point out though that while all this is great and wonderful, I did not come across any articles that examined educational strategies or curriculums that revolved around athletic trainers or in the athletic training setting when it came to usage of diagnostic ultrasound. If we look at evaluation techniques, the literature is saturated with techniques, proved, valid, reliable techniques to visualize musculoskeletal structures. And if you look at the entry-level standards put forth by Katie, athletic trainers are more than qualified to use diagnostic ultrasound when it comes to knowledge of functional anatomy, um, which obviously is an important thing to understand when using diagnostic ultrasound. We'll look at different types of tissues, of course, when you're evaluating with diagnostic ultrasound, and these different tissues are going to give off unique signals, and this is part of the learning curve when it comes to understanding diagnostic ultrasound and interpreting the results. These different appearances are called echotextures, or yeah, echotextures. Dense soft tissues such as ligaments or tendons are giving off a hyperechoic signal, and usually it's pretty easy to visualize the fiber orientation when you're using diagnostic ultrasound. Tendons tend to be a little bit more susceptible to the direction to which the sound waves hit the target tissue. Ligaments not as much. So if we look at nerves, nerves can sometimes look honeycomb in nature. They'll have that waffle texture to it when viewed transversely, and more fascicular when they're viewed longitudinally. Muscles can be a lot more varied. They can look like a starry night depending on your orientation, if it's more transverse with the cell orientation, or it can look a lot more pennate when it's viewed longitudinally. One evaluation study with diagnostic ultrasound looked at patients that had complaints of thoracocolumnar pain over ligamentous structures. And if a fracture was suspected in any of the subjects or patients in this study, an experienced sonographer performed an evaluation, and an X-ray was also obtained. The results were read by a group of clinicians, including an orthopedic surgeon, a musculoskeletal radiologist, as well as a diagnostic ultrasound sonographer. If there was a conflict between the diagnoses from any of these clinicians, the ruling went with the majority. The results of the study showed that a diagnostic ultrasound could actually be relatively, could be used reliably to examine vertebral fractures. Another study examined syndesmotic ankle sprains. This study was done on 47 professional athletes, and they were broken into 3 groups. A control group, those that presented with just a lateral ankle sprain, so your standard ATF sprain, and then those that presented with a more anterior-inferior tibiofibular ligament, so a syndesmotic sprain. Those that had the syndesmotic sprain also had an X-ray performed to rule out any bony pathology, and if there was any kind of bony involvement, they were excluded from the study. So these subjects were only strictly syndesmotic sprain, no bony pathology. The diagnostic ultrasound was used to measure the gapping between the tibia and fibula. And what they determined is that diagnostic ultrasound is effective in diagnosing syndesmotic ankle sprains when you can rule out bony pathology. So that's a pretty significant finding in my opinion. Another study looked at differences in thickness between partial and full thickness of the Achilles tendon. 26 subjects were compared using diagnostic ultrasound for what that was found actually in surgery, and the diagnostic ultrasound was correct 92% of the time. Another study examined tissue integrity post-operatively. These subjects had both a diagnostic ultrasound done as well as an MRI, and they looked specifically at rotator cuff soft tissues at 3 and 6 months post-op, as well as at 1 year post-op, and then annually thereafter. They looked at the tissues both statically and dynamically. And again, one thing that's unique with diagnostic ultrasound is that you can view tissues in a dynamic motion, but MRIs obviously cannot be used to evaluate tissues during dynamic movement. I'd like to point out once again that while reviewing the literature, there were no studies that were located that used athletic trainers as the researchers or as the clinicians in the study, as well as there was no studies that were performed in a traditional athletic training setting. So if we look at diagnostic ultrasound's usage in musculoskeletal rehabilitation, there's been many documented positive outcomes in the literature when it comes to its usage. Another study looked at diagnostic ultrasound's use on looking at identifying multifidus and transverse abdominis, and these researchers injected the subjects with a 5% hypertonic saline solution, which induced pain, and as a result, in theory, should decrease muscle contractility. There was a significant decrease in muscle thickness in 80% of the subjects, which could be viewed with the diagnostic ultrasound, and that suggests that diagnostic ultrasound could be used to assess these thickness changes to support diagnoses that identify muscle damage as a source of pathology. In another study, patients with non-chronic subacromial shoulder pain who do not respond to quote-unquote routine treatment were enrolled in this randomized control trial. The intervention group received adjustments to their treatment based upon what was found in the diagnostic ultrasounds that they received as their treatment went along, and the control group obviously just received treatment based upon what was found in the traditional evaluation. And the findings suggested that the intervention group saw more positive outcomes when compared to the control group. But again, no studies were located that used athletic trainers or were performed in a traditional athletic training setting. Majority were in very traditional, like physical therapy, outpatient, orthopedic type clinics. So to kind of wrap this up, the use of diagnostic ultrasound is a growing topic within physical medicine, and there are many positive patient and clinic-based outcomes that support the usage of diagnostic ultrasound. But again, there's very little, if any, research done specifically in athletic training or with athletic trainers. And again, as athletic trainers, we're well versed in musculoskeletal anatomy and physiology, as well as musculoskeletal evaluation techniques. But again, there's no research in this area to look at these when pairing them up with diagnostic ultrasound usage. So some areas that I've noticed that could use some research is the feasibility to use this diagnostic ultrasound in various athletic training settings. I feel that there's going to be a huge gap between using this in a clinic versus a high school versus a university. And even within the university, you could look at D1, D2, D3 type models, pro or professional level athletes as well. Another question is, will this change our clinical skill set as athletic trainers? If this becomes widespread use, are we going to use this more as a crutch? Or is this truly just going to be an enhancement to our skills, and we'll only break out the ultrasound when we really truly need to get a quote-unquote second opinion on something? And then, of course, the big elephant in the room is, can athletic trainers effectively use and interpret the results of diagnostic ultrasound evaluations? And if so, how do we educate? What's the curriculum going to look like to teach athletic trainers, both those that are still in school going through an education program versus those that have been out? And so that kind of poses my research question. How can we effectively and efficiently teach athletic trainers to use diagnostic ultrasound in a clinical setting? In our clinic, we have a GE Logic E9 diagnostic ultrasound machine, which is one of the nicer top of the line type ultrasound machines. We have many different transducer types, so there's lots of room to play with the methods of this type of study. But there are many things to consider with a study like this. Is the setting again? A high school isn't going to probably be able to afford a machine like this, so if they do, they're probably going to look at something more of like a portable model, lower end model, and as such, are they still going to be able to get the same results with a lower quality machine that may not produce as high of a quality image? Make and model of the unit, same idea. Is a lower end machine going to be able to effectively assist the clinician in making a clinical decision? And of course, the transducer type. A clinic may only be able to afford one or two transducers, and therefore may only be able to identify or look at a handful of structures. They may not have the liberty to just pick the best transducer for the body part in question to help them make a clinical decision. These are my references. I'd be happy to send them to anyone who is interested. Thank you.